Hello everyone, this is Mila. Today I'm reading Chapter 2, Living Too Short, Dying Too Long. As we rebound the corner into the 21st century, physicians and medical researchers took special notes of the state of health and medical care in the United States and the industrial world. Looking back over a century gone by, the comparison of disease are remarkable. In the early 90s, people's primary diet of infection disease. The 4 leading causes of death in U.S. back then were pneumonia, tuberculosis, diphtheria, and influenza. And people had a life expectancy of a little more than 43 years. But thanks to the discovery of antibiotics and advances in their development during the second half of the centuries, deaths due to the infection disease declined dramatically, even after the AIDS epidemic of 1980s. As we move into 21st century, we found people primarily suffering and dying from what are known as chronic degenerative disease. This includes coronary artery disease, cancers, stroke, diabetics, arthritis, macular degeneration, cataract, Alzheimer's dementia, Parkinson's disease, multiple sclerosis, and rheumatoid arthritis. The list goes on and on. Even though the average life expectancy in the United States has increased dramatically during this past century, our quality of life due to this chronic degenerative disease has taken a majority hit. We are essentially living too short, dying too long. As I heard expressed in a speech by Dr. Marion Wentz, a phenomenal immunologist and microbiologist. Dr. Wentz also helped me understand the serious danger of oxidative stress to our health and the importance of cellular nutrition. A wake-up call. Life expectancy. How long do you expect to live? Let's set aside the quality of life for a moment. As do many researchers study on longevities and consider how the U.S. compare with all the other industrial nations in the world when it comes to life expectancy and healthcare. One of the primary ways to evaluate a nation's healthcare system is to look at death rates of that country. In 1950s, United States ranked 7th among the top 21 centuries nations in the world when it comes to life expectancy. As you might imagine, we have spent far more money on healthcare since that time than any other country in the world. In 1998, we spent more than $1 trillion on healthcare, average 13.6% of our gross national products. That is more than twice as much as the next closest nation. As we have our MRI and CT scan, angioplasty, bypass surgery, total hips and knee replacements, chemotherapies, radiation therapy, antibiotics, advanced surgical technologies, advanced drugs, and intensive care units. Did all our medical advances increase U.S. life expectancy? In 1990, our nation ranked 18th in life expectancy when compared to the same 21 industrial nation for 40 years higher. In spite of the billions of dollars Americans spend on healthcare, we are now considered one of the worst industrial nations in the world when it comes to life expectancy. The healthcare system we claim is the best in the world is actually near the worst when we look at how long American lives or don't live. I asked how long you expect to live, but now envision what your last 20 years will look like. Are you getting your money's worth? I don't think so. Quality of life. I can assume you that my patients today are not as concerned with the numbers of years in their lives as they are with the quality of life in those years. Are you? The number of years we live is not usually the most important consideration when it's come to evaluating our approach to healthcare. Who wants to live a ripe old age if he cannot even recognize his closest family member because he has Alzheimer's dementia? Who look forward to suffering several joints or back pain because of degenerative arthritis? Our nation is suffering from Parkinson's disease, macular degeneration, cancer, stroke, heart disease with unprecedented frequency. No one seems to die of old age anymore. More than 60 million Americans suffering from some form of cardiovascular disease of heart and blood vessels. More than 13.6 million have coronary artery disease. Although a disease has occurred in the numbers of cardiovascular disease in the past 25 years, it still remains the number one causes of death in the United States. There are 1.5 million heart attacks each year, and about one half, or just even 700,000, are fatal. Sadly, about half of these deaths occur within the first hour of heart attack and long before the individual can even make it to the hospital. The first sign of a heart disease is more than 30% of cause in sudden death. This does not give us much time to make lifestyle change. In spite of tremendous amount of money spent on cancer research and treatment, cancer remains the second leading cause of death in the United States. There were 537,000 cancer deaths in 1995. There has been a steady increase in the number of deaths caused by cancer over the past 30 years. The U.S. spent more than $25 billion in cancer research over the past 25 years, only to see absolutely no decrease in relative number of people dying from cancer. The greatest advancements in cancer treatment had developed because of earlier diagnosis of certain cancers. Not that our treatments for cancer have been pleasant or overly effective. My patients with macular degeneration, a chronic disease affecting eyesight, visit their ophthalmologist every 6 months, only to have to make another appointment 6 months down to the road. They become frustrated knowing that the only thing their doctor is able to do is document the process of their disease. In some cases, laser treatment may have only minimum effect. If you have a loved one who is suffering from Alzheimer's dementia, you are acutely aware of the ineffectiveness of treatment. watching a parent slowly losing any reasonable function of mind became trapped in his or her own body extremely painful. It is time to go back to the drawing board. If we physicians are truly honest with ourselves, we have to admit that the treatment options we offer many of these patients are poor at best. We are not able to attach these moments the way we did with infection disease. Doctors and patients alike must take a long, hard look at how they approach healthcare today. Preventive medicine. I found disrupting the overwhelming attitude in patients today that accept as inevitable the fact that they are going to develop one or several of these chronic degenerative disease. They look to modern medicine as their savior and to medication as the cure. Sadly, only after they became ill do patients realize how ineffective our treatment actually are. As the baby boomer generation enter their 50s, I believe more and more individuals are going to become proactive with their health. One of my closest friends told me last month that he simply wants to live until he dies. Is this your desire? It certainly is mine. After practicing medicine for more than 3 decades, I find greatly disrupting the prospect of the pain and suffering that chronic degenerative disease can bring to both myself and my patients. That's why I wrote this book. That's why I recommend preventive rather than post-problem medicines. Because I needed to define what I mean by preventive. Traditional preventive medicine, earlier detection. The healthcare community prides itself on promoting preventive care. But have you ever given that approach much thought? Physicians certainly do encourage patients to have routine physician in order to maintain their health. But a closer look into doctors' helpful recommendation quickly lead one to the conclusion that they are simply attempting to detect disease earlier. Think about it. As I've mentioned, physicians routinely perform pap smear, mammogram, blood works, and the physical exam primarily to see if any silent disease already exists in their patients. What has been prevented? Obviously, the earlier these diseases are detected, the better it is for the patient. The point I want to stress here, however, is the minimal time and effort the physician or the desk or the healthcare community actually give us to teaching patients how they can protect their health. In other words, physicians are simply too busy treating disease to worry about education their patient in healthy lifestyle that help avoid developing degenerative disease in the first place. True preventive medicine. If we are going to label something preventive, then I believe it should actually prevent something. I strongly suggest that true preventive medicine involves encouraging and supporting patients to take a threefold approach: eating healthier, practicing a consistent exercise program, and consuming high-quality nutritional supplements. Empower patients to avoid getting some of this majority disease in the first place is true prevention. Does it require patient motivation? Absolutely. But most people are very willing to make this lifestyle change when they truly understand what is at stake. This is where I feel the medical field has fallen short in practicing true preventive medicine. The ingredient of a healthy lifestyle: exercise. We have forgotten about the health, our body being one of our greatest defensive against become ill. I found Dr. Kenneth Cooper to be one of the leading physicians in the field of preventive medicine. He coined the term aerobic and began the exercise craze in the earlier 1970s. Today, we all take a gospel truth in fact that to medical prevent 3 decades ago. I remember physicians arguing in meeting back then about whether encourage their patient to exercise was the right thing to do. Dr. Cooper was insist and continued to share the health benefit that exercise could bring to patient. By the end of 70s, most physicians agree with Dr. Cooper and began recommending a moderate exercise program. The Surgery Journal of the United States issued a statement in the earlier 1980s lists all the majority health benefits that result from a moderate exercise program. The highlights of this benefit are weight loss, low blood pressure, stronger bones, and a decreased risk of osteoporosis, elevates level of good HDL cholesterol, decreased level of bad LDL cholesterol, decreased level of triglyceride fat, increased strength and coordination, which lead to a decrease in risk of falls, improve sensitivity to insulin, enhance of immune system, overall increase in one of sense of well-being. One look at the list of health benefits is convincing. Any individual who chooses to develop a consistent program of moderate exercise is make an important choice to avoid develop many different diseases. A healthy diet. What about eating habit? Physicians also realize that patients who eat a low-fat diet, which includes at least 7 servings of fruits and vegetables daily, enjoy further health benefit. This includes weight loss, a decreased risk of diabetics, a decreased risk of heart disease, a decreased risk of almost all cancers, a decreased risk of high blood pressure, a decreased risk of elevated cholesterol, an enhanced immune system, an increased sensitivity to insulin, an increased energy and ability to concentrate. Let's face it, a healthy diet is a win-win situation. Nutritional supplement. As I have researched the medical literature over the past 7 years, I strongly believe that there are significant health benefits in taking high-quality nutritional supplements. Even you are in excellent health, put simply, the basic health benefits of nutritional supplements are an enhanced immune system, an enhanced antioxidant defense system, a decreased risk of coronary artery disease, a decreased risk of stroke, a decreased risk of cancer, a decreased risk of arthritis, macular degeneration, cataract, the potential for a decreased risk of Alzheimer's dementia, Parkinson's disease, asthma, obstacle lung disease, many other chronic degenerative disease. the potential for improving the chronic course of severe chronic degenerative disease. Could patients who begin a consistent exercise program and healthy diet while taking supplement actually improving their high blood pressure? Diabetics, high cholesterol, to the points of being able to avoid taking some medication? The medical literature certainly supports this approach. Almost all physicians agree that patients deserve a fair trial of healthy lifestyle change before beginning medication for such chronic condition. In reality, however, most physicians merely give lip service to lifestyle change in their office even as they are writing out prescription. You see, doctors usually assume that most patients will never change their lifestyle and the only reality salvation is the drug they can prescribe. When a physician first diagnoses a patient with high blood pressure, diabetics, or elevated cholesterol, he simply begins writing a prescription, giving patient a choice. Over the past 7 or 8 years, I have taken different attitude. I use medication as a last resort, not as my first choice. I have been amazed of how many of my patients actually willing to become more proactive with their health if even a slight chance exists as they could avoid taking any medication. Oh, sure, I still have those patients who do not consider change. For them, I still have the drugs. There are also those patients whose condition is serious enough that I have to start them on medication right away. But I also offer those individuals a chance to improve their condition over time with a healthy lifestyle change in the hope that they may someday be able to decrease or discontinue their medication. Everyone knows about the health benefit of a good exercise program and a healthy diet. Few, however, especially physicians, have any knowledge of the health benefit of taking high-quality nutritional supplements. I've mentioned that I was one of those ununiformed doctors, but countless studies prove that this trait of a healthy diet, a good exercise program, a high-quality nutritional supplement is the absolutely best way you can protect your health. It is also the best way to try to regain your health after you have lost. David's story. Let's see the theory at work. David has spent almost of his life as a driver license examiner in the state of Utah, where he lived with his wife and children. David had always enjoyed excellent health and wasn't on any medication. Earlier in 1990, however, he began noting weakness in his legs associated with unusual fatigue. By the spring of 1990, he was straggling his leg and actually falling from time to time. He had been seeing several different doctors, and a neurologist finally diagnosed him as having a rare disease called leukoencephalopathy. I'm sure David's response to the name of his disease much the way you are. What is that? The neurologist informed him that it was a progressive degenerative, demyelinating disease of the brain, quite similar to multiple sclerosis, for who those no real treatment is viable. The physician told David there were very little hope for him. The disease usually pursuing a reckless downhill course to death. The news devastated David. He returned home despondent and shocked. He had never heard of this disease, and now it was going to take his life. True to doctor's words, David became weaker. He started developing vertigo and began to lose control of his bowel and bladder. By the spring of 1993, David was wheelchair-bound. By June of 1995, the pain in his legs was so extreme that his doctor put him on an oral form of morphine. He was now totally dependent on his wife and kids for everything. Life as him had known as was gone. In November of 1995, David came down with a serious case of influenza. David became even weaker and his arms grew cold, as if they had no circulation. His doctors informed David and his family that he would not likely recover because of the underlying leukoencephalopathy. They expected him to live only a week or two. David had been under the care of the hospice program, which allowed him to stay home where he wanted to be. He and his family began making funeral plans. David grieves the loss of all that he loved while saying goodbye to family and friends. Though he had accepted his death a couple years before, the time had finally come, just as the doctor predicted. But somehow David lives through Christmas. Although he was not able to get out of bed, he didn't die either. A couple of months later, David decided to try some nutritional supplements. He started on antioxidant tablet, a mineral tablet, and some grape seed extract. Within 5 days, he was sleeping less, noted that he had a little more energy. After several weeks of taking supplement, he was able to get out of bed for short intervals. In fact, on Mother's Day, his children pushed him down to the flower shop so he could do his traditional shopping for his wife and mother. Week after week, David regained hope as he grew stronger and stronger. David remembered watching the movie Lorenzo Oil in the summer of 1996. The little boy in the movie Lorenzo had a brain disease similar to David's. While watching the movie, David was astounded to discover that the most important part of Lorenzo's treatment, the one that actually seems to heighten his decline, was grapeseed oil. David realized that his own use of grapeseed extract could be a major factor in his marked improvements. He decided that moment to start taking more of it. He soon learned that the extract is very potential antioxidant, which is the fluid around the brain can easily absorb. David's improvement after increasing the amount of grapeseed extract while continuing with the other antioxidants and minerals and was amazing. The pain in his legs began to subside. He actually began to walk again. The strain in his legs increased consistently week after week. After 2 months later, David was able to walk into church on his own for the first time in 3 years. He still had a significant shuffle to his walk, but he was walking. David's physician stopped the morphine prescription and documented his patient improvement. While he couldn't believe it, doctor couldn't deny it either. David's greatest thrill was when he was able to go back and take his driver license exam and actually pass. After all those years of testing others, he was able to drive by himself again. David still has his disease. He is not cured, but he, rather than the disease, is in control of his life. He still has a funny walk, but he doesn't mind. Every time I see David, I have to smile. It has been a delight watching his progress. He is one of the many reasons I'm positive the use of nutritional medicine holds so many promise for patients in all types of health. In this chapter, we've discovered our nation's approach to healthcare. What is yours? Do you fear grow old? Have you accepted chronic disease or pain as a given in your future? Are you willing to make necessary life change to ensure your health? I believe a full, abundant physical life does not need to start slipping away at age 40. I believe each year of your life could be your very best. It is time to stop living too short, dying too long. But first, you must understand the war that is waging within every one of our body. We will cover next week. Thank you for watching. Next time, I will be reading chapter 3, The War Within. See you next time.